Hey everybody, welcome to another episode of the Black Health Buzz. I am Dr. Maria B., your holistic physician, here to help you take back your life. Today I wanted to talk about prostate cancer within Black men. For decades now, prostate cancer has been running at the highest among Black men, and it's primarily driven by two different reasons. One, it's environmental, and the other, it's also genetics. And if we talk about the genes and how it is affecting Black men genetically, there are some statistics that I kind of jotted down. And even though we don't have control over our genetic factors, we do want to understand what part genes play and then how much of environmental segments of our lives that we can actually change in order to control some of the things that are happening within the Black community. So the first part is, I had my statistics here, and what did I do with them? Oh, here they are right here. So there was a study that was conducted by the University of Southern California at Norris Comprehensive Cancer Center in LA. And they basically ran some tests where they found that in early pregnancy that there's 50% increase in testosterone levels among mothers in African American women compared to white women who are pregnant. And also there is circulating testosterone levels that are 15% higher in African American men compared to white men. That tells us that African American men and women out the gate have a higher level of testosterone level, which also means that we have to be very careful because we run a higher risk at being exposed to different types of cancer. We're talking about prostate cancer today, but cancers in general are affecting many people within the Black community, and also the fatality rate is a lot higher. So let's talk about what we can do when looking at how to control, how to prevent, or even restoring our health for those of you who are already experiencing some of the symptoms related to prostate issues. There's a very high rate of Black men who eat high-fat diets. Your diets are really bad, and men don't do a good job at taking care of themselves. You guys, you just don't. You either have a woman in your lives or a partner in your lives who will go beyond and make sure that you're eating somewhat of a healthy meal if they're health conscious, or you just don't do it at all. There's just a very small number of men who will pay attention to their health, and I guarantee you that they learned it before leaving their homes as a child. And this is really attacking us. So the diet has to be addressed, and the amount of fat that you're eating, the amount of alcohol that's being consumed, you're not detoxing your system throughout the year. So let me just run down so that way you have some order in order for you to understand what you should be doing. Number one, at least 3 to 4 times out of the year, men, you guys should be detoxing. Now, there's different ways that you can detox. I will recommend 2. The first one would be that you detox by pulling high sugar consumption, alcohol consumption, weed consumption if you're smoking it in papers, and also meat consumption out of your diet. Look at what you do the most of, and that's what you should be taking out, because all of this is driving mucus. Mucus is what we're wanting to reduce in the body in order for you to address inflammation and to address prostate enlargement. The other piece is an enema. I would really recommend that. I know you guys have a hard time embracing that just because the tube actually goes in your rectum, but it's really, really tiny, I promise you. And if you don't have a phobia and your health is a higher priority, this is something that I feel like you would be able to overcome. If not doing an enema, then really look at the hydrocolon therapy, where you can flush your colon out and you can address releasing toxins from the vital organs that get hit the hardest, like your liver, your gallbladder, your kidney. Really look at that. High alkaline diet. So when you're taking certain foods out, make sure you're adding things back in, such as green leafy vegetables. Look at the mineral deficiencies that you have from certain toxic waste that you're exposed to. The water is important. If you can either drink filtered water, which is chlorine free, or even getting alkaline water, which is a higher concentration of your ability to have greater oxygen levels in your system. If I explained that the right way, if I didn't, I'll go back through that again. But it's all about oxygenating the blood. You have two different types of fluid in your body. You have your lymphatic fluid, which eliminates waste, and you have your red blood cells. And everything is about fluid. So your white blood cells, which is your lymphatic fluid, your red blood cells, which is your blood that controls your iron levels, and it also gives you your energy. So Black men, you got to take care of your prostate. We are running in small numbers compared to the rest of the population, and if we're a smaller group of people, then that means that we need to do a better job at taking care of ourselves, because we're passing these genes on to our families. And if you want to leave a legacy of good health behind, and if you actually want to enjoy your life, you have to do a better job at taking care of yourself. That's your Black Health Buzz for today. I'm Dr. Maria B., here to help you take back your life, and I'll see you guys next time with a new topic and new information. See ya.